Alrighty, thank you everybody for joining us today. My name is Juan Espinosa, Director of Student Success here at the UCLA School of Nursing. And today we're very excited to have 5 of our PhD alumni joining us today for our PhD alumni panel to kick off the alumni panel program this year. We'll go around the room for some introductions. Dr. Shanita Anderson currently works as a full-time RN at Cedars-Sinai Medical Center in the Emergency Department where she sits as department chair for the Nursing Professional Governance Committee. She also has partnered up with Amplify, the African American statewide coordinating center, alongside Dr. Karen Beard to help African American smokers through tailored interventions. For her most recent program, Voices of Liberation Project, she is recruiting stories from former smokers or smokers engaged in a quit journey to completely stop smoking, to showcase their victories and encourage others in their journey. She is currently certifying to be a tobacco treatment specialist, and she hopes to continue working with African Americans to address tobacco-related disease disparities, expanding outreach and designing tailored interventions. That is Dr. Shanita Anderson. I see that Remy joined as well. Thank you, Jane. Thank you, Remy, for joining us. Dr. Remy Isire is an adjunct faculty at Charles R. Drew University and a board-certified psychiatric mental health nurse practitioner. With a PhD in nursing and a public health nursing certificate, she blends research, pharmacology, psychotherapy, and teaching in her work. Her professional journey reflects resilience and late-blooming brilliance. From chemistry graduate and longtime phlebotomist to nurse, scholar, and psychiatric provider, reinventing herself at every stage. Beyond clinical practice at Kindred Mental Health Hospital, Dr. Ashire mentors undergraduate and graduate nursing students and is developing ventures within the reinvention box, including innovative wellness programs, medication management, and psychiatric-related clinical trials. She also holds a special interest in Governor Newsom's Housing First initiative, reflecting her commitment to addressing the social determinants of mental health. Anna's joining back. That was Dr. Sherry Amai. Thank you, Ashire. Dr. Maral Bakir. She graduated with her BS, MS, and ACNP and PhD from the UCLA School of Nursing. She currently works as an acute care nurse practitioner in the Neurology, Neurosurgery, Epilepsy Department. She has been conducting research since her undergraduate years at UCLA with several publications and conference presentations. She returned to UCLA shortly after obtaining her acute care nurse practitioner degree and obtained her PhD in 2024. Her research focus has been in the field of heart failure and clinical biomarkers for the advancement of clinical management in this patient population. She continues to actively conduct research and give lectures on scientific conference presentations while continuing to take care of patients in inpatient and outpatient settings. Dr. Bakir. Now for Dr. Anna Dermenchian. She is the Director of Quality and Interim Chief Quality Officer for the UCLA Department of Medicine, where she leads initiatives advance quality, patient safety, and population health across one of the largest departments within UCLA Health. She is committed to addressing systemic gaps in care and creating healthier work environments where all members of the healthcare team can thrive. Nationally, Dr. Dermenchian serves on multiple boards and committees focused on healthcare quality, ethics, and policy. Her research focuses on advancing care transitions, training interdisciplinary communication, improving respiratory vaccination rates among vulnerable populations, and applying behavioral economics to preventative health outreach. Now, last and certainly not least, Dr. Virgin Waters. She holds a PhD, MSN in Nursing Administration with a minor in Occupational Environmental Health and a BSN from the UCLA School of Nursing. Dr. Waters is currently employed as a public health nurse supervisor with the County of Los Angeles Public Health and an adjunct clinical instructor at West Coast University. She also holds here you go. She also holds a health services credential and has experience in nursing and school nursing. Her dissertation research study includes a qualitative study of knowledge and perceptions of parents and other caregivers about environmental health, heat exposure, and children's health. In 2024, she won the WIN Podium Presentation, and from 2021 to 2023, she was named a Jonas Nurse Scholar. Alrighty, thank you everybody for joining us today. We're gonna go ahead and kick it off with the questions. We'll go around the room. For our first question, what was your overall experience like in the UCLA PhD program? How about we go on Zoom with Dr. Waters?
Okay, my overall experience, it was definitely a challenge. I grew a lot in so many different areas. It was transformative. I guess that's the best word I can use. You will definitely experience transforming into another person. It shifts your thinking as a nurse. It was a journey. It was a journey, but I enjoyed it. I learned so much. I would say definitely take advantage of all the resources that they have available to you.
Thank you for that. How about Dr. Anderson?
I think that's a really good adjective, transformative. My overall experience was life kept lifing and it became a challenge on a regular basis. And I think that one of the things that I learned to do was to rely heavily on my mentors and the people that came before me. Because I think as a Capricorn, I have a problem with asking for help, right? I think I can do it. I can do everything. And, this was a journey that you really cannot do alone. And so in that way, I was reinvigorated to understand perspectives and the importance of other perspectives and the need that you have for others.
Thank you, Dr. Anderson. How about Dr. Demerchian?
Sorry, my Zoom froze, so then I jumped back in. We're asking about the PhD experience. What was it like for
Yeah,
us?
correct. What was your experience like?
Yes, I would say transformative, definitely that was an experience for me, but also it did really change the way I my perceptions, my beliefs. It was an experience, life-changing experience, but also very challenging. Um, it really made a difference to have like the connections that I did with my PhD colleagues to begin with and the support we gave each other because it is something that no one else understands except your cohort, what you're going through. With the learning, with the development, with the change. And then when you finish the coursework, working on the dissertation piece, it really takes everything that you got to continue working on what you're working on. So I think it was life-changing.
Thank you for that wonderful answer. How about Dr. Remy Isire? You're muted.
Okay. How about
There
now?
you
Can
go.
you hear me now?
Yes, thank you.
Okay, thank you. Hi, everyone. It's my pleasure to be here. Talking about my experience at UCLA, of course, it was transformative, like everyone has said. I had to reset myself in many ways. It was an eye-opener. I learned to unlearn the things that I knew in the past and keep an open mind, to understand how life is filled with different people, different perspectives, and in some cases, not exactly a right or wrong answer, but everyone just comes, with a different paradigm. And I learned to really work hard and depend on, the mentors that were available. Um, to us, that was really mind blowing because the support was really so much, and I appreciated that a lot, a lot. So it took me to a different level, in life, and I wouldn't say that I'm still the same person, that went into UCLA, before 2019. So yeah, a transformative journey for me, definitely. Thank you.
Thank you, Dr. Isar. How about in the room, Dr. Bakir?
Yeah, I definitely agree with transformative and challenging. And I also see it as before PhD and after PhD. I think there is that difference. The challenges, it really does test your character, I think, in different levels, intellectually, mentally, emotionally, and even physically in many days, especially if you're working outside, we can go more into that later, but it does really test you. But then once you're post PhD, you really see the value of everything that you learned and the challenges and how much that grew you in the program. And now they become really important tools for you to move forward in your career. So I'm really thankful actually for that challengeful experience in the PhD program.
Great, wonderful. Thank you for those answers all well around. For our next question, how did your research interest evolve during your time in the program? And we're gonna switch it around. We're gonna start in the room. Dr. Bakir.
So for me, it was a little different. I came to the program knowing what I wanted to do. I was doing research in heart failure patient population as an undergrad and then graduate level. And then I kind of continued the same topic in my PhD program. I think that does really helped me, but knowing that not everyone comes into the program with knowing what they want to do, and that's totally okay as well. So I think in that instance, my situation was a little different because I knew what I wanted to do. And with the classes, I just kind of started my researching on my topic that I knew that I wanted to focus on. The topic became more and more specific as I went through the classes and through the years. But I kind of had a broad idea of I wanted to look into heart failure. At the time, it was the pandemic, so I knew I was interested in COVID-19, and I knew I was interested in inflammation, biomarkers, and just the immune system. So eventually, I ended up combining that to become my dissertation.
Great, thank you. How about Dr. Waters?
Mine was a similar journey. Starting the PhD program, I had definite ideals about what my research interests were. And, working as a public health nurse with over 20 years in public health, and then the other 11 years in school health nursing, I've spent a lot of time working with children, families, and the public. So my research ideal actually came from my experience working with the Department of Children and Family Services as a public health nurse. And every summer, we would get these reports about children dying in these hot cars or being left. And so I would actually go out with some of the social workers that I work with on a team to investigate these cases. And I kept thinking, like, why isn't anyone doing anything about this? And that's my public health brain, that I'm always looking to prevent something. So it's interesting because that I really didn't think about going back to school to pursue a PhD, but once that idea was planted, it was like, oh, I need to find out more about this. And actually, one of the social workers I was working with at the time said, you're going to be the one to find the solution to this problem. I'm like, me? She's like, yeah. And so it spiked my interest to, apply and think about what I could do. So I wasn't really sure like how it was going to work out for, a dissertation, but I had the idea that I wanted to try to find out from a health perspective if there was anything we were missing with this problem and what we could do to try to help prevent these children from dying in these cars. So it kind of morphed as I explained to the professors my ideals. They helped me construct a way to tailor a study, and it was a qualitative study where I was able to try to explore this behavior and what was behind the parents' perceptions and what they actually knew about this situation with the children being left in the car. So it was a lot of, I had to do a lot of research to understand and try to see where the gaps were. And that's what helped to form the dissertation study. So it was definitely a journey, but I came in with a definite idea of what I wanted to do.
Thank you. How about Dr. Anderson?
So Dr. Remy and I share a history with Charles Drew University. So we both did our masters in nursing there, and in that school we were bridged into a program called Bridges. And so Bridges bridged the gap between the MSN program to the PhD program at UCLA. And so one day somebody said, you know what, you'd be really great at this. Come to this meeting. And I thought it was just an info session. And so I came to the info session and they started asking questions around the room and they said, so what's your topic? And I was like, and I was like, well, I hate cigarettes, right? So that's kind of where I started. It started with the fact that I hate cigarettes. And one of the reasons why I hate cigarettes is because my maternal grandmother died of lung cancer. And for the life of me, I couldn't understand why my mom continued to smoke. And I said, it must be something deeper, like, what is it, and I really wanted to know. And so that's where I kind of started. I started with lung cancer and I started learning about lung cancer disparities. That was one of my first literature reviews. And so eventually over time, it evolved into looking at all the populations of African Americans who smoke. And then I realized through one of my literature reviews that not many African American light smokers were centered in research, yet 50% of the African American population were light smokers. And these are people who smoke 10 or less cigarettes a day. And so that's kind of how my research streamlined down to focusing on African American light smokers and providing a qualitative study, beginning to understand what they believe their experience is like and trying to center a marginalized community in that way.
Thank you, Dr. Anderson. How about Dr. Demirchian?
Thank you for the question. Similar to Maral, my study actually, I knew the area that I wanted to study, and I thought I had picked my topic actually, but then it evolved over time. So my clinical experience is critical care. I worked with heart failure patients. I had gone into nursing because my grandmother had passed away from heart failure. So it was very personal to me. And then I ended up in a quality role. So wanted to do some not the clinical piece of it, but the other resources that are helpful for patients. So initially, I was going to look at telehealth and telemonitoring, some of the devices used. I took the qualitative series, even though I was going to do a quantitative study. I really wanted to learn as much as possible when I was in the program. So I did the qualitative series. I interviewed patients who had devices that monitored their volume. So I learned a lot, even though that wasn't my focus at the end. It ended up being COVID and I wanted to study vaccines. I saw that a lot of respiratory drivers of these patients, most patients end up in the hospital because they get a respiratory infection and their outcomes, the mortality rates even become more increased. So I ended up studying COVID vaccine, influenza, and pneumococcal, thinking that the sickest of heart failure patients had more of the vaccines, but it ended up being reversed actually, where the reduced heart failure patients were not as they had the lowest vaccines in all of them. And it surprised me how many of them, the influenza rates in general, because these patients, again, number one reason most of them get admitted is respiratory related. So it evolved over time, but I think I saw it as my own evolution, my thinking, my learning. So even if I did various studies within my PhD program, it just contributed to my own knowledge and growth. And at the end, I just became more focused. It did take me longer than the recommended years. It took me 7 years to get the PhD, but I felt like that evolution at the end, once I focused and I knew my topic, specifically what I was going to do, it was in a year and a half that I ended up proposing and defending. So it does help when you know the area of research and focusing as much as possible. But I will also say be open to the idea of learning when you show up to the program.
Thank you. How about Dr. Remy?
Okay, this is me again. Sorry, I'm in the parking structure, so it's not quite bright here. But I would say that different factors shaped my dissertation topic. So when the opportunity, just like Dr. Anderson, expressed, when the opportunity came for us, to come for the PhD program, I was super excited and I thought I will be the solution to a lot of problems in Africa and particularly Nigeria, where I am from. And so I had all these lofty ideas. I would like to do this. I want hypertension because my dad had hypertension. He had diabetes also. And I was told that, oh, no, why don't you look into something else? Because those have been, very well researched. So at the time, I thought, okay, mental health, i- it seems to be the trending, phenomenon now. And so I said, okay, I'll do mental health. And I said, oh, I would like to go back to Nigeria and pick my population over there. That also, hmm, there were mixed feelings because I was advised that, look, people who do that, they, they, it's difficult for them to graduate because nobody is coming, is going to follow you to supervise the work you're doing. Remy, why don't you pick something that that is in the United States? Pick a population that is in the United States. And once you finish, you can do whatever you like. I said, okay, fine. So then I came up with my topic, which was stigma around mental illness. Then I picked after African immigrants in the United States. I think there was something else. I don't remember now because the topic went through a lot of evolution. It was like from one class to another, this topic was just being refined, um, by different professors, based on different considerations. And also towards, the tail end, the occupational burnout component was introduced to me like, Remy, if you add this to your work, it's going to make it even more significant, more relevant. And so at the end of the day, I had stigma of mental illness going on there. I had occupational burnout, was the relationship. And then amongst African immigrant nurses. Yeah, that was quite profound, and I enjoyed, doing the work. And now well, I plan to move on, with that trend, looking at stigma, yeah, going forward. So that was it for me. A lot of refinement, evolution, polishing, that got me to where, to where I am today. Thanks.
Great, thank you.
You're welcome.
For our next question, how did you maintain balance between work life and personal life during the program?
Hmm.
Anyone would like to take this one?
I will take that one.
Go for it.
That
Yes.
was talking about life balance. Wow. So when we started the program, we were told not to work. I was a new nurse at the time. I had just gotten my MSN, from Charles Drew University. And I thought to myself, how I, I have this license now, and I was eager to work, as a nurse. And being told not to work, I thought, no, I think I can handle this. So I went ahead, and a few months after, yeah, I think in the spring semester, I got a job actually. I got a job at Kedron Hospital as a registered nurse. And I thought, look, at this point, I wouldn't like to discover things about psychiatry only in the articles. I think I would love to actually experience them. So I got the job, and then I told Dr. Mentis, who happened to be my advisor at the time. I said, yeah, Dr. Mentis, I got a job. I really would love to work. And you wouldn't believe that she said, "Oh, okay, so let Dr. Wendy Robbins, the director for the PhD, say, why don't you mention it to her?" So I did also. I wrote the email, and guess what? She said, "Oh, Remy, I don't know how you find time to do all this, all this, all this. How you're gonna combine, work and a job and what we're doing here." But for that, I think I was exempted from one or two classes at the time. She said, because your experience, is like what you're supposed to be learning. And if you are doing that, then, we're gonna take off, this course. And that was mind blowing. I told my cohort mates and they were totally shocked. Like, where does the university stand? They say, don't work and you are doing the work and you even have a benefit for it. Anyway, so that was the journey. Um, I would say that talking about balance, I don't know how easy it is to find balance. I just kept moving on. I just kept moving on, day by day, and I did what I had to do. But mind you, I would say that the only thing I did at the time was just those two items, UCLA and my, per diem job. It wasn't full time, not part time, it was per diem. So I only did that, when it was comfortable. But it was mostly UCLA, nothing but UCLA. I had I had nothing else, distracting me. So thank you.
Thank you for those words of wisdom.
You're
How
welcome.
about Dr. Anderson?
Oh boy, that's a big one.
Work-life balance.
Like,
Give it to us.
and
it
this is
possible?
why it's so big, because I don't know how it's structured now, but at the time, school was the first 2 years. So we were on campus mostly all day, every day. I think it was 4 days a week at the time. I had 5 kids at the time. I had a kid during the PhD program. And so there was no way I wasn't working. Okay. And so then I low-key had to keep it a secret because it was frowned upon, because they were like, oh, you have to give all your time, you have to do all of this. And I was like, y'all don't even pay for parking. So yeah, something's gotta give, right? So I
You don't
worked,
even
I
pay for
started,
parking.
they don't even pay for parking. I was like, so
I
like,
know.
how you gonna tell somebody not to work and you don't even pay for parking? Like, that's ridiculous. So I said I had to work, and I was blessed to start in the community hospital. It no longer exists. It shut down during the pandemic. It was Olympia Medical Center. So on days where I had school, it was so good because you can kind of like plan your schedule sometimes. And most of the time I got what I asked for. And so like on days where I had school, sometimes I just wouldn't go home. I'd sleep in the parking lot, and then power nap, and then I get in there and I muster up whatever it is that I could. And so for 2 years that went on. So in many ways, COVID was a godsend for me because it saved me 2 hour drive. Because if I had went home, I would be only at home for 2 hours before I had to come back over to Midway, which was another 2 hours in the kind of traffic driving from 6 p.m. to 7 p.m. And so like that was a time. And I don't know how it's structured now, but we also had to take biostats out of the biostats department. So when we were learning out of the biostats department, we were with physics people who this is their stuff. They do this every day. And I'm just like, so we had to get tutors. And so I'm like, I'm spending time with Phil. I have Phil on speed dial to where I'm like, okay, after class, I'm meeting with you before class, that kind of thing. So the balance of first 2 years was definitely God. It was definitely my husband, right? Being able to share the balance with those children and just being able just to plan out those days and to plan out that time of what it was that I needed and to be vocal. Hey, I need this, we need this. Hey, I feel like we were an experimental cohort at the time where they were just trying all these things on us that they hadn't tried before. And so we were like, look, this is not working for us, or this is what we need, kind of thing. And so they rolled with us and we rolled with the punches and we got through. Thank you for the question.
Great, thank you. How about Dr. Waters? Same questions. How did you maintain balance between work life and personal life during the program?
Okay, well, I guess luckily and unluckily, I work at night. So that helped because, like Dr. Anderson said, when I first started, actually Remy, Dr. Asiri and I are in the same cohort. So we were on campus, but then the pandemic hit. I think it was our spring quarter. So we went, we switched rapidly to online, and that helped because now I no longer had to commute and do that. So that helped. But I would say for me, the balance was between working and going to school, making sure that you set aside time to study, to read, to do your research. You have to set up a schedule. For me, that was what gave me balance, knowing, this is my time. And for me, a lot of studying, a lot of my writing, definitely my whole dissertation pretty much was written in the wee hours of the night. For me, I would get off from work and I'd have a schedule set. You're going to write for, 1 or 2 hours until I just couldn't write anymore. So being disciplined, having that schedule. Luckily, my sons, I'm a divorced mom, so dealing with this all by myself, but my sons are grown, so that helped. That they're, at the time they were in their 20s, so they were able to, get food for themselves or whatever. And I would tell them, hey, I have a test coming up, or I have this going on. So it goes back to what Dr. Anderson was saying, being vocal, letting those around you know what you're going through, what your schedule is, so that they can plan accordingly. So we would, work it out,
No, you
just
lost. Oh, there
making
you go.
sure that if you're able to, can you still hear me?
Yeah.
Okay. If you're able to, I found that for me, sometimes I would reach these writing blocks where I couldn't kind of think anymore to write some of the essays we had to do during the first and second year. And then definitely with the dissertation, sometimes I would feel like I'm stuck. I found that doing some type of physical activity. So for me, it was taking a walk, taking that hour, even though it's like that's taken away from other time that you have to study or do other things. But getting outside, doing some type of physical activity, or for you, it might be going to the gym, it might be swimming, whatever your physical stress relief is, I would say try to keep that in, because that actually helped to clear my mind. I would come back and I was able to focus. And I'm like, wow, this is cool. It took some of the stress away, but it also gave me that extra energy. So trying to balance, make sure you're eating well, try to get some sleep. I didn't get a lot of sleep, but there were days where I did. So try to sleep, exercise, and depend on family to get that balance.
Thank you, Dr. Waters. How about Dr. Demerchian?
I don't know if there's truly a balance. I think you just take it at each quarter at a time, each year at a time, because initially the course load was extensive. I was a BSN to PhD, so I wanted to like keep in the same courses as my cohort. So I ended up just kind of doubling in some quarters, and I worked full time, but I had a lot of support from my leadership. So I was on campus. I was able to attend everything that I wanted to, the extracurricular things, while still like maintaining a full-time job, but having flexibility to do that. At the time I was single. I ended up like meeting my husband now towards fifth, sixth year of my PhD program, which put a pressure to like get it done. And then so I finished, I got married, and I had a child right away, or like a year later. So I think that keeping your personal life in mind really helps you then to set these goals and meet the milestones. On the professional side, having accountable buddies, like some of my cohort, we maintained that connection even after finishing the coursework. We were in a group chat, so we always updated each other. We had writing days where we would meet up to work on our writing, where you're sitting next to someone, they're working on something different, but it still helps to like have that moral support. So I will say that really it's important to, as much as possible, build a community and keep that community, because it is so isolating because you're the only one working on this project. You have your committee, but they're not, they're not the ones who are doing the work. You're doing the writing, you're doing your research. So I will say that it's so helpful to have other colleagues who are there doing their work, and parallel, you're making progress.
Thank you for that. Now in the room, Dr. Bakir.
Yeah, I agree with everyone. I'm not sure that it's really possible to balance the social life and the PhD. For me, so I was a new NP when I started the program. I was working outside, not in this hospital, but somewhere else. So I also had to commute initially because of pandemic. Our classes were also online, so that helped a lot the first 2 quarters. Then we were moved in person. I remember waking up super early. My first job was a little flexible, so I was able to do this, to go see all the patients. I would get like number of 20 patients, 10 patients to see for that day, and then finish them all in the morning, run here, drive here to attend my in-person classes, and then continue on my PhD work. In the middle of the program, I actually switched my job to UCLA, and I love my advisor, and she, her, and she's very straightforward. She just looked at me and said, "You are crazy for not only working, but you're actually switching your job. Now you're going to have to get trained there. And then it's going to be like even more extra work on you," which was very true, because now I had to adjust to this job. But the lucky thing was that I was already finished with the first 2 years of classes. So I was in the time of my own, writing my own dissertation, defending my topic. So I had a little bit more flexibility from the campus side, but it was still very challenging. I would just say, take it as I would recommend, and I know it's not possible, and I couldn't always do this either, try not to procrastinate, just do small steps each day. You do have writer's block. The nature did help me as well. Like I would take small breaks, go out, get some fresh air, and come back to school and just writing. Having the group chat, just having someone to talk to, because people outside of this class, they don't really understand what you're going through. So just being very close with your classmates, having that constant communication, just supporting each other, meeting up, writing together. We've also done that. It's always been very helpful. And just know that it's not going to be perfect. This is just a season of your life. Just kind of keep the end as your goal and just keep, pushing for that, because there will be times where you will feel like, okay, I can't do this anymore. And that's totally normal. So don't feel alone in that. Just talk to somebody and just keep pushing forward. Just take small steps to move forward.
Thank you for that wonderful answer. Moving right along for our next question. What skills or experiences from the PhD program have been most valuable in your current role? We'll flip it around a little bit. Dr. Bakir.
Most valuable. I think the whole program is it's been a very unique experience. I loved the critical thinking, the fact that I was was pushed to be outside of my comfort zone. I actually enjoyed that. And taking classes with my classmates, but then also becoming, your own PI when you're ready to write your own dissertation. So you're at that point a little more independent, and this is your project. So if you don't push this through, no one is really going to do that for you, right? So the whole experience I really enjoyed. And I personally really enjoyed the cognate classes too. That gave me the opportunity to move outside of my class and sit with other people in grad levels, and that really gave me different perspective on my own project, because I was taking all these like other immunobiology classes, just sitting together with other majors, kind of getting their perspectives, reading other research papers, but also having the time with my classmates in my home, in my school here. So I like that combination a lot for me.
Great. Thank you. How about Dr. Anderson on Zoom?
So I'll identify two things. So yes, the classes were really, really, really beneficial for me. Like not only the cognates, but actually the nursing courses, because we were able to pick and choose the things that we kind of wanted to focus on. And in that way, it kind of refined my topic, right? So, if we were in the concepts class and I started thinking about the different measurements that they have, where they're measuring tobacco dependence and all of these things. So that made me privy to those kind of things that existed already, the things that maybe were in times past that may, help me to formulate my own measures in the future. Or even if we were talking about the literature reviews, because now that I'm working with Dr. Beard, who's been, in tobacco control for like 40 years, and I'm able to sit down with her with patients and talk to them about their experience. And I know that I've read the literature, and I know the literature like the back of my hand, and it's congruent to the experiences that I'm having right now. It just feels amazing. It feels like it wasn't all for naught, and that it's confirmatory that, your work meant something, and that you're able to use what you've learned and incorporate that into continued learning and helping others. So I think that's really great.
Thank you, Dr. Anderson. How about Dr. Waters?
I would say that it helped me to definitely the coursework for the PhD helped to prepare me for my adjunct clinical role teaching. Just being able to do the research and understanding different learning and learning modalities for the students, but also just it gives you a different perspective, understanding that there's so many different viewpoints and being open to that. The research that I did just for my dissertation, just being exposed to different schools of thoughts, because it's not a lot of specific nursing research, more environmental health. So having some cognates in those areas also helped me to prepare for my role, because you're just dealing with so much and you have to be well versed on different topics when you're teaching. So my brain and help me to just bring all that in as I'm sharing this information with the students. It has been a journey, and I knew from, I guess, the beginning, my focus was more becoming, an instructor, being more on that side than doing the actual research as a career. So definitely enjoying my first job teaching. It's been rewarding.
Great, thank you. How about Dr. Darmenchian?
Like others, I found it helpful to take those cognates outside of school of nursing. I did it at School of Public Health and took a lot of health policy courses. And I work on the Department of Medicine on the health system side. So a lot of my colleagues are from the health services researcher side, which are some of the faculty in the School of Public Health. So it was nice to get to know them as professors, because now I work with them on various projects, or I pull them in for various resources or teaching from my team. I think because of the PhD, I was given the opportunity to be a chief quality officer. I'm serving as interim for the past 2 years, and the position is being posted and a national search is happening. And it's always been a physician. So I work in a department, all the leadership are either physicians, clinical physicians, or physician scientists. There are some non-physician PhDs, like scientists in the health services side, like psychologists or public health, but there are no nurses at the leadership level. So having a PhD has given me a seat at the table, which I'm so happy and proud. I didn't know that I would have this opportunity, honestly, because I always thought there's this bias, and there still is, but at least like I can challenge it because I have the degree and the knowledge and knowing the scientific foundation. So it's just not like I'm not just a nurse scientist, but I know the science, and I could work with very interdisciplinary collaborative people. And I've been able to publish, especially this past year, I've been able to put the skills in use and publish multiple papers in various fields within quality improvement, within research, because of that experience. So I'm just, even though it was challenging and I don't want to repeat my experience, I'm happy I have it and I could use my degree and really like have like this opportunity to serve at a leadership level.
Thank you. How about Dr. Remy Isire?
Thank you. I would say that every aspect of the program, was quite valuable. The didactic was a different experience for me because I hadn't, okay, well, I just finished the master's, but prior to that, I hadn't been in like school setting, for quite a while. And so, that was the first 2 years prepared me for, the journey. Not just because, we read and read, I read articles like never. And it felt like, what is going on here? My eyeballs, were almost popping out of, the sockets. There was a lot to read, philosophy of nursing, a lot of information, just to take in. And I so appreciated that because it just took me to another level, prepared me for like a new phase of life. And then I went into the research itself, and that also, like one of the previous speakers said, that you are the one doing your research. The mentors are there, to guide you, to support you. But you that will, do your writing, you go into the field, recruit your participants and all of that. I I think I will forever, appreciate all those experiences, and they have prepared me for what I'm doing now, even though I'm still working as an RN. But that's because when I left, actually just before I finished from UCLA, I enrolled into the Psych and P program because I just had the desire to cover every aspect of nursing. Talk about academia, talk about clinical, because looking into articles is, you see everything there. And so like I wanted to touch base, I wanted to touch base with everything possible. I wanted to be able to experience, the clinical practice, teaching. I've been teaching now since 2021, and then the research itself, it's been really helpful. And I remember while we were in the program, um, a professor was invited from, I think, University of Pennsylvania, and she came to speak with us, and we were asking questions after, and I told her, that I think I would like to focus on teaching, and she said, come on, do it all. Do it all. There is benefit, because then you widen your horizon. You see like the total picture, the helicopter picture of what is going on, and there's so much that you can do with that. And so, well, that's where I am now. Um, I have one foot in clinical practice, I have teaching, and then research would always be there. So, thanks.
Thank you, everyone. And we are nearing the hour, so we're going to go ahead and do our final question. And I'm going to give you a couple of seconds to think about this one. What does it mean for you to be a PhD prepared Bruin nurse? I'll let you reflect on your time here at the School of Nursing, the relationships you made, study sessions, cramming for tests and papers. Who would like to take that one?
I'll take it.
Go for it.
For me, it meant expansion. I knew what it meant to help individuals, and I wanted to know what it meant to help more than individuals. And so to help populations and to help communities. And so for me, it was an expansion of my ability to help others, and to be able to double back because I went to UC Berkeley and my major was integrated biology, and I have love for biology. I have a love for physiology. And so being able to double back into a career that that connects those dots for people, and being able to make it connect to communities where we can make holistic changes was a real big deal for me. And I feel like with PhD you can do anything. I mean, look at Remy, like do absolutely anything, go absolutely anywhere. And it's amazing. I think nurses are my favorite people.
Absolutely.
How about Dr. Waters?
For me, I feel like the PhD from UCLA, it opens up so many doors, and I would have to agree with Dr. Anderson that you do feel like you can do anything. It's such an honor to accomplish such a huge feat, something that I thought about when I first became a student at UCLA in the BSN program. I met an instructor who was very instrumental in influencing my career in public health. And I would sit there and think about this lady, how intelligent she was and how much she inspired me. And, you know, I would sit there and sometimes dream like, oh, I wonder if I would ever become, you know, a professor or obtain my PhD. So it's almost surreal for me that the journey was a long journey, but I did it. And going, you know, being at UCLA pretty much my whole career as a nurse, I was able just to experience that whole journey. And I feel well prepared to take on any challenge as a nurse, and look forward to you know, seeing how this all plays out. But I would say it's going to be difficult. It's a difficult experience, but it's one that's worth it. It's definitely worth it. So if you ever become discouraged and think you can't do it, just keep pushing. Know that you can. You can. You're going to gain that reward. Just keep pushing. I have no regrets. I have no
That's
regrets.
wonderful to hear. Thank you. How about Dr. Remy Asire?
Yeah, thank you. You know, for me, it's a mindset thing. You know, like they say that when you obtain your bachelor's, it's like, you know, that's for your parents because, you know, they push you, you know, they're there for you. Likewise, you go for your master's, you know, to an extent. But when you move on to the doctoral level, you do not belong to yourself. You belong to your community because that program prepares you not just, you know, like, okay, we have PhD in nursing, but it's not just for nursing. It just opens you up and opens your mind, you know, to the world. Globally, you are relevant. And whatever you take on, you know, the world is able to listen to you. And so, you know, is a huge task, is a huge responsibility. And, you know, it's important that we realize that and just make ourselves available to serve. You know, it's about serving our world. And that is what this PhD is to me. That, you know, at this phase of life, I am available simply. I'm simply available, you know, for my world. That's it. Thank
Thank
you.
you.
You're welcome.
And Dr. Bakir here in the room.
Yeah, so UCLA is very personal to me because I've done all my education here. I started as an undergrad and my NP and then my PhD. So it was very sweet to not only, you know, transition through all the classes, meeting all the professors. I feel like I've kind of met everyone on in the program, but also see myself grow as a professional person. And I think getting a PhD, I would think UCLA for me would be the best place to do this because of the leadership, the science, the resources, the opportunities that you have here. Not every place is able to provide. I can truly attest to that. And even just the complexity and the challenging of the program, it does truly help you to shape you into that true leadership and scientist character that you're really going to need it in the future. And like Anna was saying, like in my current role, I'm also acting as a leader. You know, having that PhD also truly changed my relationship with my patients. I have my own clinics. I'm pretty independent provider. I'm working as a physician. Basically, I'm getting all the different kinds of patients in the epilepsy department. I'm also put into very different leadership positions because of my research and science background. And I know this being from UCLA has made a big difference as well in that, improving, our practice, providing care, and just constantly making those changes and doing further research. So like everyone else has also said, it's really been helpful to get my degree and just go through this PhD program. I do also have no regrets, although it was very challenging. It's really shaped me into the leader that I am today. So I'm very thankful for that.
Thank you, Dr. Bakir. We're gonna go ahead and close out. Thank you so much for joining us this hour. Join us back in the winter quarter when the alumni panel program returns, and I hope you have a great day. Thank you, everyone.
Thank you.
Bye. Thank you all.
Bye.
Bye.
Thank you.
Thank you so much. Bye,
Ruth.
everyone.
Good to
Bye. Hey, I'll call you.
Okay. Wait for it.